everyone, welcome back to Active Mindfulness Tuesday questions. I've had a question from Simon today asking about whether it's true that mindfulness can trigger trauma or traumatic memories. So thank you, Simon, that's a really great question. So when you have trauma, quite often what we do is we develop coping strategies to not spend a lot of time in our minds. And mindfulness kind of does the opposite. It helps you to notice and be with your mind. So for someone with an unprocessed trauma, that can be quite difficult. It can be quite scary and it can bring up an awful lot for them. So although I wouldn't say that it means you can never do mindfulness if you've had a trauma, what I would say is it needs to be managed well. So there is a difference in a kind of clinical setting between a trauma, someone who's been through a traumatic event, and post-traumatic stress disorder, where you get kind of a re-experiencing or flashback experience. When someone is actively having symptoms of post-traumatic stress disorder, I would not recommend mindfulness. But if someone has some symptoms that have been worked through and they've done some kind of reliving cognitive behavioral therapy and they feel in a better place, then there might be a role for mindfulness. It would just mean that I, as a practitioner, would be quite careful about the kind of mindfulness that we use. Some of the meditations are a bit more active in your mind than others and would feel more comfortable for someone with difficult memories. So I hope that helps. Take care, everyone, and I will see you next week.